Let us see how can we treat the emergencies, or what are the first aids or medical treatment we can give when there is emergency in the dental office. So here the management of medical emergencies. So how can we manage the medical emergencies? So medical emergencies can happen because of advances in the medicine. So if we give the advanced medications, or if we give more than one medications, so if there are any side effects caused, so then that leads to the emergency. So advances in the medication, long lifespan. So if the drug is having long T half, so because of the long T half, the drug is staying in the body for longer period of time, and then it is showing some side effects leading to the emergency. Multiple medications, when we use 2 or 3 or more medications, then that leads to side effects. And medically compromised. So if a person is unable to take, he's medically compromised because of the financial status or because of his inability to take any medication, that may lead to severe toxicity, or it may lead to severe diseased condition for that person and longer appointment. So if a person is taking any therapy for longer period of time, so that may lead to the medical emergency. So this medical emergency has to be managed by, first we have to recognize what is the emergency the person is suffering from, and we have to give prevention. So before the emergency occurs, first when we find the symptoms, then immediately the prevention has to be given, and preparation, the person or the dentist or the people who are there in the dental office, they should be prepared. If there is any emergency occur, what is the first aid immediately they have to give to the person, and basic life support, that is basic first aid to be given, and cardiopulmonary resuscitation. So if in severe conditions or heart related disorders, then this treatment is recommended, and specific medical emergencies. So prevention. So before any medical emergencies occur, first when we observe the symptoms, so immediately the prevention has to be given. And in order to give any prevention, we need to know the patient, and never give a prevention to a stranger, because we don't know what medical history the stranger is having. So if your prevention is giving them toxicity, if your prevention is causing some harmful effect to their body, then that may lead to severe adverse conditions. So whenever we give any prevention, we need to know what the patient and even the medical history of the patient. So in prevention, 90% of the life-threatening situations can be prevented. So whatever the life situations, like diabetes or cancer or heart-related disorders, whatever it may be, life-threatening diseases can be prevented in the initial stages only. But we, because of our negligence and because of our carelessness, and we are bringing that situation to severe condition, and 10% will occur in spite of all preventive efforts. So whatever the 10% disease are there, even though we give preventive measures also, that may lead to severity of the disease. Prevention can be given when only we know the medical history of the patient. So we need to know the medical history of the patient before, what disease he suffered from and what medication he took. And physical evaluation, we need to evaluate the person physically, whether he is having blood glucose levels normal or not, whether his blood pressure is normal or not, what is body weight, everything should be measured. And vital signs, so vital signs should be measured. And then dialogue history, and determination of medical risk, how far he is risk to medications, and stress reduction. So all these have to be made into consideration before giving the prevention. And medical history, if we see the medical history, what we have to take into consideration. So first we have to review. So first we have to take the review from the person, what medical history he has, and update. We need to update what previously if he is taking any medication, and if he is not feeling better with that medication, then how can we update, how can we give better medication for that person. And medication should be given in medical consultation. We need to give a consultant, if he is suffering from CNS related disorder, then we need to give a medical advice that consult so and so doctor in order to prevent, or else in order to reduce the risk of his life. Physical evaluation. So if we see physical evaluation, that should be length of time since last evaluation. So how the normal checkup like blood pressure, heart rate, how all they are there. So how long it took for the person before evaluation, what is his previous evaluation, and now what is the time gap. So what is the length of the time taken for previous physical evaluation to be taken into considerations. And vital signs. And visual inspection of the patients. Visually we need to inspect the patients, how they are looking, whether they reduce their weight or not, whether they are looking weak or not. And referral to a physician. We need to give a referral of the physician. And what are the vital signs we need to consider before giving any prevention? So we need to check the blood pressure of the person using sphygmomanometer, and pulse rate of the person, and respiratory rate, how far he is able to breathe properly, temperature, height and weight. So all these have to be examined physically in order to give prevention and give advice or referral for a physician. Identification of medical risks. How can we identify the person is having medical risk? So ability of the patient to safely tolerate dental treatment. If a person is coming to the dentist, then he has to be able to tolerate the treatment which is given. If he is not able to tolerate, then he is highly risk for that dental treatment. And does a patient represent the increased medical risk? So if we give that treatment also, whether the patient can tolerate or whether he is having more chances of that risk. So we have to identify that. And can patient be managed in the dental office? So if we give dental treatment, if the person is having higher risk and if the emergency is needed, then the facilities are available in the dental office or not in order to manage the patient emergency. These all have to be taken into consideration. These all we have to identify as a risk factors before giving the treatment. So, patient assessment. So how can we assess a patient? So there are 4 steps to treat patient or else to give the treatment for that patient. First thing is that R, recognition of the disease. R in the sense, first we have to recognize what disease he is suffering from, and A is that assessment of the risk. If we give the treatment, how far he is prone to risk, and M is for management for safety. So if he is prone to risk, how far we can manage and give safety for him, and emergency care. So if at all emergency, can we able to reduce that emergency or not? So what are the medical emergencies? So generally what are the medical emergencies we can observe? So the patients who are suffering with high blood pressure, cardiac insufficiency, asthma, angina, diabetes, these all are life-threatening diseases. So any cardiovascular related disorder or diabetes if the patient is suffering from, then that patient has to be treated medically immediately. And high anxiety levels, and combination of both may trigger physical response. So if the person is having one or more diseases, then he is the person is more emergent to medical treatment. So how can we give prevention for this medical emergency? So we have to give prevention by first identifying or recognizing the patient anxiety level. So how far, whether he is anxiety or whether he is in depression condition. So based on that, we can give the prevention for this medical emergency. Before the medical emergency is done, how can we give the prevention? So we have to measure the anxiety levels, and we need to modify the dental therapy. So if we are giving any dental treatment for that patient, then we need to modify the dental therapy and prevent an emergency. Now let us see what are the medical emergency treatments given for various diseases in dental office. For example, if we take adrenal crisis. So if there is any adrenal crisis, then the patient we need to terminate the treatment. The patient should not be given any treatment at all. And then we need to record the vital signs. So first, if there is any adrenal crisis for that person and you are giving a dental therapy or dental treatment, then if he is more prone, there is a risk of adrenal crisis, then we need to stop the therapy immediately, and then we need to observe vital symptoms like a blood pressure, weight, temperature and all, and thereby the person should be placed in Trendelenburg's position. That is, the person should be placed inclined in a slant position in order to prevent the risk of this adrenal crisis. The person should have proper airway. This is proper ventilation should be given to the person in order for him to breathe properly, and thereby the emergency protocol should be followed. And if the patient is having insufficiency to breathe, So if the patient is having any suffocation, even though if you keep him in the inclined position, then you need to give oxygen supplements, and we need to administer saline, and hydrocortisone should be given. The other one is airway obstruction. So if there is any airway obstruction emergency, what is the treatment we can give? First, we have to position him head. So the the head should be positioned, or the person should stand in a proper position, and remove the foreign objects. In the sense, the foreign objects, especially in the dental office, like we find the sweeping motion of the fingers. So what if the person is having the sweeping motion like this, the sweeping motion of the fingers, and the straight forceps which are there, and the suction, so all these should be kept away from the person, because they may contain some allergens, and thereby these allergens then potentiate the airway obstruction of the person. Perform the abdominal thrust. So here what we have to do, we need to catch the position in the picture which is shown, and we need to just tap him on his back in order to make his breathe proper, and repeat as needed, and thereby the person has to be taken medical care. The other type of emergency is that anaphylactic or allergy. So anaphylaxis is a serious allergic reaction which is occurring. So here we need to give the basic life support. So if a person is having an emergency because of the, in the dental office we find even though if we sterilize the things also, so there may be some sort of allergens or foreign particles. So they may cause some allergic reactions. So if a person is having if a person is very sensitive to allergic reactions of foreign bodies, then immediately we should give the basic life support. So first aid should be given, and epinephrine injection should be given. So if we find the person is suffering from anaphylactic reactions, immediately the epinephrine injection should be given through IM route, and oxygen supply should be given. And after that, even though if it's not in a proper way, or if the allergic reactions are not getting down, then diphenhydramine injection should be given through IM route. Or we can also give corticosteroids, and in severe conditions we have to give cardiac pulmonary resuscitation, and airway management should be given. We have to give proper air supply or oxygen supplements for that person. In anesthetic reaction, so how can we give the treatment in anesthetic reaction? So the reaction can be varied based on the dose. So the reaction to the anesthesia can be based on the dose of the anesthesia what we have given, and based on the severity of the anesthesia. So generally we in the dental office mostly we give the local anesthetics. So here we need to make the dose adjustable, and the severity of the drug should also be taken care. And the result most are result of either local anesthesia or the vasoconstrictors with the formulation. So here when we are giving anesthesia in severe conditions, that will lead to vasoconstrictive effect also. And toxicity is more if we give through IV route, and reaction can occur within 30 to 60 seconds or 1 hour. So if a person is having if a person is allergic to the anesthesia, then the reaction occurs within 30 to 60 seconds, and it lasts for about 1 hour if an anesthesia is given through IV route. So immediately proper care should be given for that person. So here local anesthesia dosing should be calculated. So in order to prevent this allergic reaction, local anesthesia dose should be adjusted based on the patient's physical condition. So if a person is physically fit, then the dose should be given enough in order to anesthetize the local area. And based on the body weight also. So based on these two parameters, the dose has to be reduced if a person is allergic to local anesthesia. And local anesthesia toxicity. So if a person is having it has become toxic for local anesthesia, so what when can be given? So initially the basic cardiac life support. So first initially the breathing should be given, oxygen supplement should be given for that person. And even though his heartbeat or his cardiac symptoms are severe, then we have to press our hands against the heart, so in order to regain his heartbeat to normal. And we have to give the oxygen supply. And even though if we give all these preventions or first aid, if we give all these first aid also and the person is not able to recover, immediately the person should be shifted to the hospital. The other one is angina pectoris. So how can the angina pectoris emergency can be treated in dental office? So here, avoid situations needing increased oxygen demands. So if a person is there suffering from angina, then the person should have proper oxygen supply. So his environment should not be restricted. We should have proper ventilation around him. Otherwise, the person will not be able to breathe properly, and thereby the angina can be potentiated. And stop the procedure and allow the patient to rest. So if we are giving dental therapy and the person is having angina, then immediately the therapy should be stopped and the person should be in rest position, and the person should be placed in semi-reclined position. Semi-reclined in the sense the person should be in an angle of 45 degrees. So if a person is like this, then he should be at the angle of 45 degrees, and thereby the the decreased oxygen supply can be reduced, and provide the oxygen supplement for that person. So even though after you give the oxygen, the person is not able to resist or come out of that angina pectoris, then immediately nitroglycerin should be administered. So nitroglycerin at the dose of 0.4 mg for every 5 minutes we have to give for 3 doses. So 3 doses should be given for every 5 minutes, and thereby the person can be relieved to some extent. So even though if he is not relieved, then immediately the person should be taken to hospital. The other one is asthma. So asthma is the one which is potentiated because of the allergens. So first thing, we need to take care that we have a proper cleanly or hygiene environment. So if a person is having asthma, then we should make sure that the person should be ventilated properly. So there should not be any difficulty in his breathing. If at all it is there, then immediately we need to give oxygen supplements to him. And we need to keep the patient away from any irritants. So there may be some local anesthesias or general anesthesias like halogen inhalation anesthesia. So these may cause irritation to the person potentiating asthma. So the person should be avoided from any irritant from him. And inhalations used, so we need to give mostly inhalations like albuterol, Ventolin, and Proventil or Terbutaline. So these inhalations should be given in order to treat the medical emergency, and we need to monitor the vital symptoms. So vital symptoms of the person should be monitored like blood pressure, heart rate and all, and oxygen supply should be given. The other one is cardiac arrhythmiasis. So cardiac arrhythmiasis in the sense if there is any disturbances in the rhythm of the heart. And here we need to, in this cardiac emergency, in this emergency conditions, so first we need to measure the heart rate, how far the heart rate is proper, and place the patient in reclined position. So the patient should be placed completely at 180 degrees positions, and thereby the person can be able to rest for some time and administer the oxygen supplement. The other one is cerebrovascular accident or stroke. So this cerebrovascular accident or stroke, if a person is having that emergency, then how can we treat? So here, assess and monitor the vital symptoms. So whatever the emergency it may be, first what we need to do is we need to measure the vital symptoms, because ultimately any disease or disorder that will affect on the cardiac system. And initiate the basic cardiac life supports. If a person is unable to breathe or his heart rate is not proper, so then we need to put a pressure on the heart, and thereby the heart rate is proper. Administer oxygen if the person becomes unconscious. So if a person is unconscious because of the difficulty in breathing, then immediately the person should be given oxygen supplement, and the person should be placed in supine position. So the person should be placed either in the resting position or in the reversed position. And thereby we need to activate the EMS. The other one is congestive heart failure. So congestive heart failure, here also correctly we need to in this congestive heart failure, first we need to identify what is the cause for this. So why the heart has failed, because so what is the cause for the failure of the heart, and when we know the cause, then immediately oxygen supplement should be given to that person, and immediately the emergency, we need to measure the vital sign and symptoms. So once we measure the vital sign and symptoms, then immediately the person should be placed in the semi-reclined position. So first we need to identify the cause, then oxygen supplement should be given, and we need to monitor the vital symptoms. And if the person is still not relieved from that, then the person should be placed in the semi-reclined position. What are the drug related emergencies? So if a person is having any problem or any side effects of toxicity of the drugs, so how can we treat that emergency? So hypotension with evidence of shock. So here, whether if a person is having lower blood pressure, so because of the fall in the blood pressure, the person is having shock and which is non-responsive. So mostly this type of shock is non-responsive. The person will not be able to respond. So in that condition, immediately fluid therapy. So fluid therapy in the form of infusion should be given, and immediately the person should be taken to the hospital with the proper care. The other one is hyperglycemia or hypoglycemia. So when if there is any elevated blood pressure, blood glucose levels or decreased blood glucose levels, so first we need to stop the procedure. So we should not give any type of dental therapy for that particular patient, and we need to administer glucose. So this glucose can be administered either in the form of oral or in the form of IV infusion, and we need to give basic life support for the person, and immediately the person should be moved to the medical emergency as soon as possible. Hypertension. So how this hypertension can be treated? So first thing is that we need to monitor the blood pressure of that person. So immediately what is the blood pressure? So whether it is very high, so then if it is very high, then we need to give the antihypertensive agents which are available. So focus on the prevention, make sure the medication is taken properly. So first, when we are giving anesthesia without epinephrine to that person, then that leads to more cause of hypertension. So here what we have to give, we are giving anesthesia, then the epinephrine should be given along with anesthesia in order to reduce the hypotensive effect. So if this preventive measure is not taken by the dentist, then immediately the person should be given basic life support, and then we should give the cardiopulmonary resuscitation therapy, and even though if he is not relieved, then immediately the person should be shifted to the medical treatment. The other one is hyperventilation. So in hypoventilation, what does this cause? So overventilation is caused, and because of that the person has some discomfort. So first thing is that we should not give we should stop the treatment. So the treatment should be stopped immediately, and the person, we need to reassure the patient. So we need to make sure whether the patient is feeling comfort or not, and if not, we need to find, or we need to regulate the respiration. So we need to find whether the person is respirating properly or not, and thereby we need to give some exhalations in order to relieve his condition. And the other one is nose bleeding. So if there is any nose bleeding to the patient, so what treatment we have to give? So we need to request the patient. So what we have to do, if there is any nose bleeding, we need to tell the patient to close or pinch his nostrils for some period, so in order to stop the blood vessel. So we need to block the nose against the flow of blood, and thereby the blood is stopped. And if not, what we have to do, we need to put some cold ice or cold substance in order to reduce the blood, and apply some cold pressure. So we have to put some cold pressure around his neck and around the nose in order to stop bleeding, and we have to put the position in 90 degrees angle. So if a person is bleeding, then the person should be sitting in the 90 degrees angle in order to prevent the blood flow. The other one is intraoral lacerations. So intraoral lacerations are nothing but injury to the skin. So if there is any damage or cut, so if there is any damage or cut intraorally in the oral cavity, so how can we treat that? So first, if there is any bleeding or else injury in the oral cavity, then we should not give any dental therapy, and we need to remove the foreign particles from the mouth. So if we find any foreign objects or the irritants which are causing or damage to that oral cavity, then that has to be removed immediately, because the foreign particles through that skin cut or through the skin injury, they may enter into the body, that may lead to the infection, and pressure should be applied at the his site with sterile gauge. So with the sterile gauge, the pressure should be applied in order to prevent the bleeding out of that injury. And then wound should be flushed and that should be cleaned with the saline. So whatever the wound is there, we need to apply the saline. We need to flush it with the saline in order to remove any foreign particles. And immediately the person should be moved to the medical emergency. The other one is myocardial infarction. So myocardial infarction is a condition where the cardiac tissue is replaced with the fibrous tissue. That is also cardiac related disorder. So first, in this condition, the dental treatment should be stopped and the person should be placed in semi-reclined position. So if the person is placed in semi-reclined position, then the blood flow will be proper to his heart, and thereby the heart rate can be normal if there is any increased or decreased heartbeat. And the oxygen supplement should be given to that person, and we need to monitor the basic vital sign and symptoms. And we should give the nitroglycerin. We should give the sublingual nitroglycerin. Sublingual should be placed here under your tongue. Here under the tongue, then in the nitroglycerin should be placed as a sublingual route in the dose of 0.4 mg for every 5 minutes for 3 doses. And thereby the person should be immediately moved to the hospital. Ocular injuries. So if there is any injury to our eye, then how can we take? So we need to make sure that the person is not exposed to irritant, or the person eyes are not exposed to any irritants, and blink repeatedly to stimulate the flow. So here the tear flow, if there is any irritation to his eye, we need to blink immediately so that through the tears, whatever the foreign particles are there, they come out of the eye. And locate the object by lifting and rolling back the eyelids. So in order to make our vision proper, so we need to rotate our eyelids, and thereby if there is any foreign objects inside also, they may move and they can come out. And we need to wash the eye with proper water. So we need to wash our eyes with distilled water in order to remove any dirt particles, and the person should be given protective eyewear. So if he is giving the treatment, then proper eyewear glasses should be given to that person in order to allow, or else so that the foreign particles don't enter into his eye. Another one is seizures. So seizures are nothing but epileptic conditions. So here we should place the person in reclined or supine position. So the person should be completely in the rest position or in the supine position, and protect the patient from injury. So if the person is having seizures or epileptics or fits, then the person should not have any injury. I mean, they move their body all over. So we have to make sure that because of their body movement, they won't be injured, and we need to give oxygen supply to them. And here what we have to do is so in a few cases the person may feel or else the person may vomit during seizure. So we need to prevent that, and we need to give the vital symptoms, and proper basic support, life support should be given to that person, and immediately the person should be taken to the medical care. The other one is shock. So if a person is having shock, then how can we treat that? So here, first, if a person is having shock, then we need to give oxygen supply immediately. And once the oxygen supply is given, the vital sign and symptoms have to be measured. And once the vital sign and symptoms have to be measured, the person should be placed in the Transberg position. That is, the person should be there in inclined position. So once the person is in inclined position, and thereby we need to make sure the person is in quiet and calm condition. So if he's feeling anxiety, then there are chances of potentiation of shock, and immediately the person should be shifted to hospital. The other one is syncope. Syncope is nothing but a situation where the person will lose the consciousness because of fall in blood pressure. So if there is any decreased blood pressure, then the person will lose the consciousness. This condition is called syncope. So for such kind of patients, the patient should be placed in supine position, and the head should be lower the feet if possible. In the sense, the patient should be placed in reverse positions, and we need to maintain the open airway. So if the person is having such condition, then we need to move away. So if there is a fall in blood pressure, thereby the person won't be able to breathe properly. The oxygen supply will not be there, and thereby the person faints. In that condition, we need to administer oxygen, and we need to give the ammonia inhalant. So in order to make the person regain his conscious, the ammonia inhalant should be given, and we need to monitor the vital symptoms. And once the vital symptoms are monitored, even though if the person is not feeling better, immediately he need to give medical treatment.